And a little bit later on in the program, we'll speak with the local alderman, Matt O'Shea, specifically about some of his ideas to protect police officers and other first responders as we see cases of COVID-19 expanding among them as well. And now, Brandis, we go back to you.
Paris, thank you. And now to Carol Marine on how medical providers are handling the coronavirus pandemic. Carol.
As we mentioned earlier, Illinois now has more than 5,000 reported cases of coronavirus. With limited testing, that number is assumed to be low. Hundreds of new cases a day, 73 deaths thus far, and experts say we haven't seen the worst of the COVID-19 wave here yet. So how are healthcare providers on the front lines dealing with that? What are hospitals doing to prepare in the coming weeks? Here with some thoughts and answers, A.J. Wilhelmi, the president and CEO of the Illinois Health and Hospital Association, representing more than 200 hospitals and health systems across the state. He served as an Illinois state senator from 2005 to 2010, representing Joliet and other areas. Alice Johnson is the executive director of the Illinois Nurses Association. And Dr. Jay Chauhan, an ear, nose, and throat specialist and head neck surgeon, serves as president of the Chicago Medical Society, an organization that represents more than 17,000 physicians. Welcome, all of you, to Chicago tonight. And Ms. Johnson, I'm going to start with you. In the breaking news of this day, 12 nurses at the University of Illinois hospitals have tested positive for COVID-19. Do you believe there are more?
Yes, in fact, we learned this morning that the number of nurses that are infected with COVID-19 at the University of Illinois Hospital we're up to 18 registered nurses. In addition, there are also advanced practice registered nurses who have been infected. At this time, there are no licensed practical nurses that are infected that we're aware of, but there are some that are being watched to see if they are infected. So this is something that's of great concern to us and is of great concern to our membership working at all of our healthcare facilities.
Dr. Chauhan, you've got a new survey your organization does of 900 physicians in Cook County. 85% of the emergency room docs say they believe they have been exposed. That is a terrifying number, is it not?
It's quite high, Carol, but if you look at the data that's coming out of Europe and in China, you're finding that 14% of the COVID positive patients in Spain are healthcare workers. And in Italy, they have twice the number of healthcare workers that have been tested positive for COVID-19 as well as compared to China. So our trajectory right now is following that of Spain and Italy. And we're quite concerned about our healthcare providers. They're being asked to use personal protective equipment or PPEs beyond the usual and customary manner that we've used for decades in this country because of the short supply.
Mr. Wilhelmi, Mr. Wilhelmi, half of those doctors that were surveyed by the Medical Society said their hospitals did not have a plan should they get sick, and almost half of those recently surveyed said their hospitals were not protecting them. Are the hospitals you represent doing enough?
The protection and safety of our healthcare workers is job number one. Without our healthcare workforce, there is no response. And so we are doing everything possible to bring in additional PPE, right? Medical supplies, masks and gowns, and other supplies that will keep our healthcare workers safe and protected so that they can make sure that they're on the front lines to care for their patients, including their COVID-19 patients. So we are ramping up that PPE effort every day, Carol.
But I know you're aware that Governor Pritzker today said he's been asking for help, he's been asking for PPE, he gets a fraction of what he's asking for, and today they sent the wrong kinds of masks. Ms. Johnson, is there enough PPE right now in these hospitals and emergency rooms?
No, I can tell you that what is happening right now is that at many places, the PPE is being used in an unsafe way. That includes not disposing of the PPE or the N95 masks after caring for each patient, wearing an N95 mask for an entire shift. That also includes reuse of the PPE in unsafe ways. What's happening is that the standards for the PPE are being driven down not by what is safe, but by what is available. And our nurses are the people on the front lines risking their lives because of the lack of available PPE. We're struggling every day to make sure that and demanding that the PPE be used in the proper way, not a standard that's lowered to meet the supply that's available. Because
it compromises medical personnel. I'm curious how our staff, and this to all of you, being notified, doctors, nurses, aides, that someone in their proximity, a healthcare worker, has been exposed. Are they being told that?
Carol, this is AJ. We are making sure to follow the right protocols, the CDC guidelines. We are communicating on a daily basis with our staff. And as I said before, our frontline workers, our healthcare workers, keeping them safe and protected is job number one. And we're doing everything within our powers to do so. And we are effectively communicating so that our staff knows what's on the ground and the key information that they need to be protected. But ultimately, it comes down to accessing that PPE, bringing it into Illinois, and making sure we keep our healthcare workers safe. It's job number one with the hospitals.
So it can be job number one, but it sounds, based on what Ms. Johnson and Dr. Chauhan are saying, that job number one is not being accomplished. Is that correct, Dr. Chauhan?
Our understanding from emergency room physicians at certain institutions that are being asked to use the PPE masks, the N95s, for more than one shift. So once they complete one shift and they've worn that mask, then they put it in a bag and then they reuse it in their next shift. The problem with that is if you've had a patient that has had exposure, you have the potential of those virons being on that mask, the virus being on that mask and cross-contaminating. Especially in the emergency room setting, when you're almost cheek to cheek examining a patient, your exposure to the virus is quite acute. And unfortunately, if you see the videos from New York, you see a lot of the emergency room staff wearing surgical masks. These surgical masks are not protective against the virus.
Which is exactly what Governor Pritzker just said today. He got surgical masks when that isn't what he needed. McCormick Place is going to be converted to a 3,000-bed hospital, but you can't have a hospital without doctors and nurses and protective gear and respirators. Can we build out 3,000 more beds and staff it as it stands right now, Mr. Wilhelmy?
Carol, we know that right now hospitals are not doing elective surgeries and procedures, so we have workforce in the way of physicians and nurses that are not currently engaged to their capacity. So we want to make sure that we utilize that workforce, those physicians and nurses, to their capacity, and that is one option. The other is regulations have been relaxed, and we appreciate the governor's leadership in this to bring in retired providers as well as providers from across state lines. We need all hands on deck, and we are in this together. And if we do that, we can make sure that we have the workforce necessary in our hospitals as well as with the McCormick Place facility as well.
Ms. Johnson, do you agree with that?
The lack of nurses, of experienced skilled nurses at the bedside cannot be solved by bringing in nurses from other states, and it cannot be solved by just bringing in retired nurses. First of all, retired nurses are at potentially at a greater risk. They're potentially older. This is a virus that is more of a risk to you if you are older. And secondly, Illinois already lacked enough nurses. There was a projected need of an additional 19,000 nurses at the bedside over the next 10 years. Illinois has an issue with keeping nurses at the bedside because nursing is an incredibly difficult job. And setting aside the pandemic, nurses every day face workplace violence, high injury rates, stress, sexual harassment, understaffing. These are things that they're dealing with in the best of circumstances.
Dr. Chauhan, forgive me for interrupting. I'm trying to hear all of you from as much as you can say. Dr. Chauhan, you're a surgeon. You're not an emergency doc. Are people with your incredible expertise easily repurposed into profound respiratory issues and emergency medicine?
First of all, with the ethics in medicine, when you get called upon, based upon your capacity, you serve as best as you can, and usually under the auspices of another specialist in the time of need. Most bylaws for hospitals include disaster situations in which if you're called upon, you're responsible to come serve the community. If we look once again to the epicenter of the COVID-19 infection in the United States, in New York, the chief of surgery at Presbyterian Hospital called on the surgeons to come in and assist in the intensive care unit.
One last
because they're finding a lot of the healthcare workers and physicians and nurses are becoming infected, and they're drawing on this on subspecialists and surgeons to come in and assist in the care of the patients.
One last thing, and we only have 30 seconds. We are being told that ICU beds are currently at capacity already in Illinois. Is that true, Mr. Wilhelmi?
We were working with a infectious disease doctor at the Chicago Medical Society. We were informed that 2 teaching hospitals were at capacity yesterday, and they were nearing full capacity. And I was just told before this interview that we are at capacity in the ICU in the city of Chicago at this time.
Dr. Chauhan, Ms. Johnson, Mr. Wilhelmi, thank you very much for being with us. I know we're going to come back to you again and again because we need so much of this information. Thank you again. Up next.